Welcome. I am Dr. Patrice Berry, and I am joined by a very special guest. And this is being broadcast out to both of our communities. So I will start off with an introduction, and thank you for everybody that has already provided comments over in the chat. And if you do have questions as we're going, please let us know. But I am Dr. Patrice Berry. I'm a licensed psychologist, author, speaker, and content creator. And today we're just going to talk a little bit more about Mental Health Awareness Month. And I'm going to pass it to Tika. If you could introduce yourself.
Sure. So I am Tika. I'm a licensed clinical social worker by education and training. But I also like to say that I am a divine creator by purpose. So I enjoy writing, speaking, and working with individuals who are on the path to wholeness and wellness and who are ready to do the work. And so I've been doing that for wow, like 15 years now. So it has been a long time coming, but that is who I am.
And I will also mention, so Tika, we actually used to work together.
Yes.
I was one of her supervisors back in
Mhm.
the day. And just post COVID, we were able to reconnect. Our journeys have gone in different ways. And I really like highlighting different mental health professionals. But
Mhm.
let's first start off with, why is mental health awareness important to you?
Yes. Um, I really think that mental health awareness is important to me because I grew up in a family that was really strong in our faith, grew up in the church, grew up in a family of also immigrant parents where mental health was not necessarily something that we always talked about, or there was more so like a stigma, or even sometimes a discrimination against people who would say that they had a mental illness or were seeking treatment. And so, because mental health awareness is about destigmatizing, reducing that discrimination, improving the sensitization when you're talking to someone or even considering your own mental health and treatment. That really is important to me, especially as a Black woman um, who are herself is making sure that she's taking care of her mental health. And I love that this year's theme is more than enough because it lets you know that no matter who you are, where you come from, your background, your experiences, just because you may or someone you love may be experiencing a mental health problem, concern, it doesn't mean that you're any less enough in this world. So I love that too.
I love that, and I didn't even know there was a theme, and I
Yeah.
love that it's more than enough because
Mhm.
the reason why mental health awareness is important to me is
Mhm.
because I grew up feeling like I wasn't enough, and I really wish that I had started my mental
Yeah.
health journey sooner
Yeah.
because I thought it's like, "Oh, I'm okay enough," or I thought
Mhm.
being strong was not going to therapy, and anyone who
Yeah.
thinks that people are weak who go to therapy has never been to therapy
Right.
because it is so hard to sit across from a stranger and
Mhm.
bear everything and just
Mhm.
talk about things and
Yeah.
to work on yourself. I think it
Yeah.
takes a lot of strength to do that.
It does. It takes incredible strength to say and really admit I'm not okay. I'm willing to accept that I need help. I'm willing to make changes from all the things that maybe were normalized in my life, but are actually dysfunctional or actually not really helping me, even though it may be familiar. That takes incredible strength, So I agree. I agree. You're not weak for seeking mental health treatment or for saying that I am not okay. It is actually a strength.
Yes. So what made you
Yes.
decide to become a social worker?
Honestly, I don't know if you know this, Dr. B. I don't know if I told you this story even when we were working together, but I did not originally want to be a social worker. When I went to college, I was going to be a pediatrician. And I
I
think,
was pre-med for like a semester and then I realized I don't like
yes.
blood.
Yeah. Oh, for me, it was organic chem. That is what that was the straw that broke the camel's back. But I think I thought that I wanted to be in the healthcare or the medical healthcare field because I had family that was in it. Family like my mom who was a nurse, my great grandmother who was in the healthcare field, and so I was like, oh, okay, I'll just continue down this path. But thankfully, I went to a liberal arts college where I was able to take a lot of different classes just to kind of see before I declared my major what I enjoyed, and so I ended up taking a social work class. I can't remember the exact title of it, but it was centered around like not human behavior, but basically like a sociology class. So what is happening in the environment, what's happening as far as experiences like cultural or current events. And so how that centered and how social work played a part in that. And I was like, okay, I actually kind of like this. So I worked with one of my mentors on campus. Her name is Lorraine Hall. And she was like, well, take some of these assessments, kind of like the like Myers-Briggs, or you take an assessment to see kind of what career path you should take. Basically, it was a career counselor. And she was like, well, take another social work class. And if you enjoy it, you should declare that your major. And so I took one or two more the second semester of my freshman year. And then first semester of sophomore year, I decided to declare social work. And it aligned because I had always worked with young people, whether it's babysitting, mentoring, tutoring, doing after school programs. I don't think I knew, hey, you can have an impact and influence in their lives, and it doesn't have to be through the path of being a medical doctor or professional. And so through that, I had the internships, had the jobs that aligned with social work, and then eventually decided, okay, let's go to grad school. Let's see what else I can do with this. And here I am. That's the short and sweet version. But yeah, here I
That is
am.
that is awesome. So I decided to become a psychologist. I had a
Mhm.
bad experience with a school counselor when I was in middle
Mm,
school, and it was through that experience that I was like, I think I want to work with kids. I
yeah,
think I want to help kids,
yeah.
because the school counselor was talking to me, she was talking down to me. And
Mm,
if and thank goodness I was in a safe situation, but if I
mhm,
wasn't in a safe situation, if something wasn't
mm,
okay, I would have
yeah.
never told her. And so being able to create safe spaces for kids and teens, and now I've transitioned more to working with adults.
Yep.
That's been incredibly important and valuable to me. And then,
Yeah.
so I like highlighting different types of mental health providers, because
Mhm.
there are psychologists, there are social workers, there are licensed professional counselors, there
Yep.
are family and marriage therapists, and there are,
Mhm.
each state has their own counseling boards and
Yep.
they define everything. And then I like to differentiate, because some people do coaching, but make sure if you do
Right.
coaching, because that's not regulated, make sure to
Mhm.
research the person to make
Mhm.
sure that they have the credentials and qualifications to really
Yeah.
help you on that journey. And if you need therapy, look for therapy. Um,
Yes.
because therapy, it's a regulated field where if something isn't okay, you actually have a recourse versus if something
Mhm.
happens with a coach, there really isn't anyone that you can really report to.
Right.
And I do think within social work there can be some misconceptions and misjudgments. And so,
Yes.
can you talk about that a little bit?
Sure, sure. I mean, if people think about it, I'm sure they may have seen like on TV, or maybe historically, social workers were the ones who were quote unquote snatching kids, right? So they would go into the home and they would basically take children out of them, separate families from, or separate children from their families. And they thought that is what a social worker is. Or, even some would say, social workers, they don't really get paid much. You're a public servant, or you're someone who works um, for the public. And so there's no way that you can really thrive in that career. And I think those are two of the main misconceptions I heard. Even my own family, when I told them I wanted to be a social worker, they were like, what are you going to do with that? Are you going to just work for social services? Yeah, horrible stereotypes about being a social worker. When actually, I even want to debunk the first myth that social workers remove children. Actually, our goal is to preserve the family.
Yeah.
And so in our those kind of efforts, so those who may work for child protective services or for social services, their goal is to equip the family, is to give them the tools and the resources they need so that they can stay together. If a child is in danger, of course you want to prioritize that child's health and wellness. And so if that means maybe separating for a moment, of course, because that child's health is priority, but the goal is to reunify. The goal is to give the family, the parents, what they need so that they can bring them back together. And so if people were to just kind of turn off the TV or do a little bit of research, or even ask a social worker, they would see that that is one very small experience, but one path that a social worker can go down. But social workers don't only just work in like social services. They
And
can work in, yeah.
And then also I like, because sometimes social workers that work in social services might
Mm-hmm.
actually have a bachelor's or a master's and not be
Exactly.
clinical social workers. Because I think
Right.
there's a difference between a clinical social worker and
Mm-hmm.
then a social worker at CPS or Adult Protective Services,
Right.
or a different agent, or even the school social worker.
Yep.
Many school social workers, depending on your state, depending on everything,
Mm-hmm.
sometimes they might be licensed. I
Mm-hmm.
know in Virginia, our social workers are the ones that typically deal with the more significant mental health concerns within a
Mm-hmm.
school versus the guidance counselors, because the guidance counselors also don't always have to be licensed. And
Yep.
so I like talking about these different things, because I think sometimes we hear counselor and we
Mm-hmm.
assume, oh, this person's licensed, or we hear
Right.
social worker and we assume, like, sometimes we can make different assumptions.
Yes, a lot of assumptions take place. And I like how you differentiated between that as well, because that is one difference between a social worker who is a licensed clinical social worker that can independently practice. And those are typically the ones you may see who are therapists, who are mental health therapists, who are psychotherapists, versus a social worker that you may see in the community or in a hospital or in a school. And even in hospitals, majority of the time, some of them are even licensed, or even the ones that are care managers or case managers. And so there is a broad experience and background to being a social worker. So yeah, but those are two of the main misconceptions I see, is that social workers take kids, or that social workers won't really be able to thrive and make a living in society.
And within my field, I think with
Mm-hmm.
being a psychologist,
Mm-hmm.
I think sometimes people think to go to therapy, they have to go to a psychologist. So I
Right.
have so many people that call, and then people get psychologist and psychiatrist
They get it mixed
confused.
up.
And
Mm-hmm.
so sometimes I get calls for people and they're like, I need my medicine. And I'm like, oh no,
That's not
wrong
what I do.
person. In my state, because there are
Yeah.
some states where
Mm-hmm.
psychologists can prescribe. I don't want it. I don't want prescription ability. That's not, because you have to learn so much more. Like, there is,
Uh-huh.
being a prescriber, there's a lot that goes into that, and it's just
Yeah.
something that I don't really want. And
Right.
so I think I often have to just help give that education, that psychologist, so if somebody's looking for therapy, that they don't
Mm-hmm.
have to see a psychologist. Sometimes
Right.
people think that psychologists have more therapy, have more training with therapy, and it's like, no.
Mm.
um, like, we receive similar amounts of training
Very
regarding
similar.
therapy,
Mm-hmm.
and that one isn't better at therapy. That
Right.
actually, if somebody is certified in EMDR, and
Mm-hmm.
so I don't have, so I'm an adoption competent therapist. I've done
Mm-hmm.
like the TFCBT certification,
Mm-hmm.
and there are some other things that I would want to do,
Mm-hmm.
but there might be a licensed social worker that has a EMDR training that might be a
Exactly.
better fit for a person. And so I like having those conversations.
Exactly. Exactly. Yeah. And that's something that people just may not know. And so that may also be another reason mental health awareness is important, because it can highlight the different paths of treatment you can go down and show you that one is not better than the other, but maybe one is more suited or may fit your needs. And so you just kind of have to increase that knowledge and know what you're looking for. So that is a good point too.
So let's talk a little bit about the work that you do and any things that you're
Sure.
kind of passionate about with the work that you're doing right now.
Sure. So, the work that I'm doing right now, I feel like it is the path that I was not um, I could have never dreamed that I would be working as a private practice therapist that centered the work of Black women, centered my work around Black women, because I started out working with children and youth, whether it was with like program evaluation or working in the homes with the families and the schools and even in the hospital. And so I thought, oh, I'm going to be working with youth and families or children my entire career. But there was a point where I took a leap of faith and decided, hey, let's go down a different path. Let's decide to open a private practice. With your experience and with your background, you can have impact and influence here as well. And I think another reason it was important to me to take that leap is because I myself am a Black woman who is managing my own feelings of depression and anxiety, and how that presents when I'm, what we call high functioning, meaning it seems like everything is okay. I'm presenting like, things are well put together, and I am, grinding. And it's, sometimes it is admirable to do this hustle and grind step, but at the end of the day I was feeling exhausted or overwhelmed, and it was really impacting my life. And so the reason that I center that is because I know for myself, I wish someone would have said, hey, you don't have to wear this mask, you don't have to wear this cape, it's okay to not be okay, or to say no, or to put this down. And so my work centers that those Black women, because I hope to hold that space for them, to say, hey, here, you're not obligated to do, you're not obligated to wear a certain title. You don't have to come here and be mom. You don't have to come here and be the stellar and star employee. You don't have to come here and be the amazing wife. You can just be yourself and get the tools and equip yourself so that you can return to being those great roles. But that's not the sum of who you are. Let's get to what it is that is impacting the core of who you are. And so that work has been something I've been passionate about and centered for about, I would say, 3 years. I wouldn't even, let me take that back. I wouldn't limit it to 3 years. I think I've been more intentional about it in these 3 years because of the private practice. But even before that, I feel like I had an awareness that I really wanted myself and those who are around me to feel safe, to not be okay.
Yes, yes. And thank you to everybody that's over in the comments. Hella Swanky, hello, hello. We are so glad to have a guest today. And if you're catching up on replay, go ahead and catch up. But I love that you found a way to shift what you were doing. So I did a very
Mm-hmm.
similar thing.
Yep.
I started working with children and families. I also started with in-home, and I really enjoyed doing that type of work. But then I realized that, oh, wait a minute, if the
Yeah.
adults aren't okay, the kids aren't going to be okay. And that
Yeah.
really, I during COVID was when I
Mm-hmm.
really started working one-on-one with parents, with
Mm-hmm.
a lot of people that just so happened to be, they were coming for their own therapy as they were
Right.
trying to manage, their schedule and their kids' schedule and all of those things. And they were starting to fall apart. And
Mm-hmm.
understandably, because I would tell them, I'd be honest and be like, I'm an essential worker and my kid is in daycare.
Yes.
like okay, like, Patrice, how do you do it? Like my
Right.
kid, my
I'm
kid's in
I'm I'm
daycare right
trying.
now.
Yeah.
And
Yeah.
there were about, during the whole time, I think there was like 2 months that I was home. And
Mm-hmm.
those 2 months, it was difficult, and it really took using all the skills that I had, and then also going
Mm-hmm.
back for my own therapy at times,
Yeah.
just to be able to get through it. And so I really like being able to normalize and show up as
Mm-hmm.
my authentic self. Because when I
Yeah.
was in grad school, I used to straighten my hair to go
Uh-huh.
on interviews. I would never wear like huge, big, bulky earrings. There are times that I wear jeans on a Monday because I'm still Dr.
Yes.
Barry. If I have on, because I used to only wear jeans on Friday. Like I would only,
Casual Friday.
I was so in my head about all of
Yeah.
these different things. And then working for myself freed me to be able to talk about things that are really important to me,
Yeah.
like, different inequities and different
Mm-hmm.
passions that I have. And so I'm glad. And can you remind, you said divine creation, what was
Mm-hmm.
that thing you said at the
A
beginning?
divine creator.
Divine
Divine
creator.
creator. So, okay, there's a story behind where even that identifying label came from. I don't even call it a label. I think it's a purpose. Is when I did take the leap of faith to quit my job. So that was December 2019. I didn't really have a plan
Was that
B.
leaving me? Was you quit? Was
I
that
no no no. I left.
it was before that?
I
Okay.
left working with you. That was. Can you believe it? That was March. No, what was that? That was December of 2017.
I can't
Because it was
remember.
right after I think I got my license.
Okay.
Yes, that was, oh gosh, that feels so long ago. Um, But no, this was a couple years later, and I didn't have a plan B, so I was driving Lyft, which actually, now that when people ask me, that was probably one of the most fun times of my life. But and it was right before the pandemic, so thank God I was able to make a shift after that. But I was kind of scrolling Instagram, and a college friend of mine had been posting about how she was like, her name was Monique, and she said she was like Monique 3.0. And this was like her way of saying, like, I have went on a self-discovery journey. I feel like I'm more aligned with my purpose, and I'm excited to pursue my dreams. And I'm asking her, like, well, what did you do? Did you read a book? Did you take some sort of online course? And so she was like, yes, here's like a really good friend of mine. She has this course. It was called Accessing Your Crown, and her name is Tanisha Grant Keita. And her course, I feel like it really changed like the trajectory of my life. And one part of that course was amazing, was to identify what it is that you're purposed to do. And so helping you kind of bring together your capabilities, your competencies, and I think it was like your capabilities, competency, and there was another C. I wish I could remember it. It'll come back to me like at 11 o'clock tonight. But in all of that, to say that she encouraged us to say, create your mission statement and make sure that you're calling yourself what you truly are. And so my faith is really important to me. And I feel like the gifts and talents and skills I have are not something that, yes, I went to school for it. Yes, I have the education and training for it, but this is not necessarily something that I am doing on my own. I do feel like I am doing this underneath the guidance and the power of God. That's my belief. And so that is where divine creator came from. So the things that I write, and even my practice and the way that I approach, my own wellness and healing journey, and then other things that are extension of me, whether it's like the podcast or even some like brand things that I enjoy doing. All of that is a part of that divine creation, because I'm hoping that I can just like leave this earth giving everything, all of my gifts, all the offerings, and feeling, not necessarily depleted, but feeling excited and proud that I was able to say I gave all that I had, and I didn't keep it for myself.
And that just reminds me of just living out the purpose or having a
Mm-hmm.
mission, because I think when things get hard, it's good to know that it's for something. Because
Yeah.
I work with a lot of clients that maybe they hate their job, like they really really are struggling on their job, and if they
Mhm,
can find some amount of purpose, if they can remember
mhm,
why, and if they can't,
mhm.
sometimes some people do just need a different job.
Yeah,
but
just
but
leave.
sometimes it's just it's getting that inner fulfillment.
Mhm.
And often when things are hard, all I see is the hard things, and I have
Yeah,
to look for the things that are going well. I have to
yeah,
intentionally seek out the good. And
yeah.
so, can you tell us a little bit about your podcast?
Sure, sure. So, and the podcast, I think, is one of those things that I'm able to say, okay, this over here, I feel like it's the intentional good and purpose, because even though I do feel excited and I feel really grateful that I'm able to be on the path that I am, it's not easy. Sometimes it is hard, sometimes it is stressful, sometimes I am tired, and I'm just like, how am I going to do this today? But the podcast, I feel, was a space where I could tell my story and encourage others to tell their story. And so the podcast is called Here We Are. And Here We Are, the title came from one of my other really a modality, an experience that I'm passionate about is mindfulness. And so about being in the present, breathing in the now, and not necessarily just avoiding the past or the future, but letting those inform where we are now as well. And so part of the tagline for the podcast is remembering where we've been, knowing where we're going, and then taking up space in the present through the art of storytelling. And I launched the podcast very recently, April of 2023. But so far it has felt like someone said in the comments, like a passion project. I'm enjoying it, having a really good time. And I have so far even had a guest, my first guest on the podcast that launched last Friday, who shared their story of being unapologetic about their path through their own mental health and illness and their recovery from substance abuse addiction. And so I enjoy it. If you have a chance, check it out. It is on launched on this YouTube channel as well as on Facebook and Instagram. But one of the things I think connects it to my training and education is also the modality that's called narrative therapy.
Yeah.
And so, kind of bringing yourself outside of the problem or maybe the experience that you've had, deconstructing it, and maybe rewriting or finding the purpose in that story, and taking control of it instead of letting it control you and how you show up in the world. And so, I'm able to kind of slide that in there based on training, but
Yes.
I hope that people really do feel encouraged and inspired by it.
And do you bring guests on your podcast, or is it
I
something
do.
that you how do you do that?
So I started out just me. It was a
Yeah.
solo podcast where I
Mhm.
was sharing some of my own experiences, and it was an extension to of a blog, one of my blogs. And it was because I would blog and write about my experiences, basically as an author. Like literally, it reads as like a tale of fiction, because it would paint the picture. But I decided, okay, what if I did this verbally? And so doing that, I started out just by myself, and I would share kind of like what are the mental health nuggets or the lessons learned that can come from this. And sometimes it'll be strictly psychoeducational. I'll read an article, give you some sort of journal study, and sometimes it'll integrate humor or faith or even music. And so I brought my first guest on last week, and I'm excited to bring even more guests on because even though I have my own story, I know that my reach can only go but so far because I'm one person. I'm authentic in it and people can relate, but that's just one perspective. And I feel like other guests could share a story of someone who may need to hear it where I may not be that person. And so having guests has been pretty exciting too.
That is really awesome. And so my mom and I launched a podcast, and I launched my
Yes.
podcast after being a guest on multiple other people's podcasts, and
Mm-hmm.
everybody would be like, you know, when is your podcast? When is your podcast? And
Yeah.
so my mom and I launched it. I want to say it was back. Oh my gosh, because I think we're on our third season, and so I think it was
I was
two
gonna
years ago.
say, yeah, because I remember
Yeah.
on
Yep.
Clubhouse too, like you would be on Clubhouse, and because that was like almost another form of podcasting, but just
It
live.
was.
And Clubhouse
It
took over during the
was.
pandemic.
I
So
was on
that's
it way too
exciting.
much.
I, me too, me too. It would almost kind of be something I would just listen to like the radio. It was funny. How is that though, doing a podcast with your mom? Because I love that connection and that legacy that you all can share.
And the name of the podcast is Legacy Moments,
Yeah.
and we have a really good relationship, and our
Mhm.
tagline is having authentic conversations about
Mhm.
life, business, and so much more. And so her and
Mhm.
I, we sit down. So I bring the psychological perspective, and
Mhm.
she brings the leadership business perspective, and we just talk.
Yeah.
And so we were recording weekly, and
Mhm.
that got to be because even with taking breaks for the summer and taking breaks for the winter,
Yeah. It's a lot.
it just got to be a little bit too much, and so we
Yeah.
are recording monthly right now.
Okay.
But it has been a journey, and just being
Mhm.
able to just sit down and share
Mhm.
those stories. We end up talking about like different I don't know, like we end up, so we used to sometimes record after hours because I
Uh-huh.
would stream it live on TikTok, and
Uh-huh.
sometimes I would put our, you know, just laughing and
Yeah.
answering questions. We would put it up later,
Uh-huh.
but I do think having safe spaces for people to share and connect and be authentic, that is
Mhm.
incredibly important. And so many people
Yeah.
have difficult relationships with a parent, and
Mhm.
my mom is willing
Mhm.
to grow, so sometimes I have to like step
Mm.
in
Yeah.
because she's still learning. So certain terms, or
Mhm.
she might say something, or she might say a word, and I'm like, don't.
Can't
That's
say
not.
that. Hold
You
on.
can't say that. Yes. And it's not. So I try to not use words because we're talking about mental health awareness. I try to
Right.
not use words like crazy. I try
Right.
to not, you know, use certain things. And she's from a
Yeah.
different generation where their language was just
Exactly.
different. And so she's open to that feedback, and I always play with her because I'm like, this is You're on my channel.
Right. I'm in charge now.
I'm in charge. And so I just and it was easier having a conversation because I was wondering how you liked having the conversation with somebody else
Mhm.
versus talking by yourself, because I really like engaging, especially
Mhm.
if you have the video. I really
Mhm.
like having that back and forth
Yeah,
because I think it gives people space to go a little bit deeper, because I
it
feel like
does.
in relationships they can be mirrors
Yeah.
where we can show different sides that the other
Yeah.
person might not have expected.
I agree. I agree. That experience in having it one on video and being able to have a
Yeah.
guest where it feels like a conversation, it
Mhm.
was almost like a mirror because it kind of broadened my perspective one, but then I learned a lot about my guest or about the other person right along with the listeners. And so in hearing them authentically share their story, the goal was like, okay, yes, we have to encourage others, but I had to take a step back and say, well, this is encouraging me as well, or I'm learning a lot about myself and the guest as well. And a lot of times there's like a personal connection between this. Like my first guest was my cousin, but I would learn so much about her journey that I did not even know. And we're family, you know? And so I agree. It is easier to have a guest because it's a conversation versus just with myself. It can feel, I still feel comfortable and it feels authentic, but it's more centered just around my story. And so it can get kind of short or it can feel kind of like even scripted sometimes because I'm reading
Yeah.
and writing all the notes, but in the conversation, it just flows. Like even today, it's like, we can just go back and forth and ask each other questions
Yeah.
because even watching you work with your mom, I'm always curious because I feel like as I get older, I'm learning more about my mom and her journey. And I'm like, wait, what? You experienced what? This was your relationship with your mom? You all said this to each other. Like I am learning so much more that I'm getting older. And so even in working with your mom, do you feel like you're learning more about her?
So, in finding my authentic self, it was good
Mhm.
for me to learn about, because there can be generational trauma and there can also be
Mhm.
generational resilience, but
Mhm.
learning a little bit more about her story.
Yeah.
So, when I first became a psychologist, I would sometimes make myself small, or
Mm.
I would, because I had a tendency of coming across intimidating, or I don't know, like sometimes, and now I love it. I love to say, I'm not intimidating, they were
You're
intimidated. Like
intimidated.
it's
Yes.
like that's like you
That's
own
not me. That's on you. That's you.
that's not me.
Mhm.
And
Mhm.
so and I used to engage in a lot of people pleasing, and a lot of that was a
Same.
trauma response, because
Mhm.
my mom, so she attended like integrated, so we're thinking like my mom attended integrated schools, where
Mhm.
schools had only been integrated for a certain period of time
Mm.
within
Mhm.
her area. Thankfully
Yeah.
it was all safe for her and she
Yeah.
didn't run into any
Yeah.
major issues or anything,
Wow.
but just some of that racial trauma, and I
Mhm.
like somebody said race-based trauma, that
Mhm.
our family had kind of experienced. I realized
Yeah.
that it was impacting how I was operating now, and being aware of it let me be more like, okay, so I'm going to make this shift.
Yeah.
And because sometimes I've had individuals come in to work with me, and if I'm not the right fit for them, and
Mhm.
if we don't look the same, I typically refer them to somebody that's more of a match to how they
Mhm.
look.
Same.
And because it's like what might have happened is you might have had difficulty, you might have assumed based on my voice that I
Right.
looked different, that we were going to engage differently. You weren't expecting my hair to change every week, I don't know, like, and that's not my problem, and I used
Yeah.
to make that my problem.
Mm.
And I'm
Mhm.
just so glad that I've been able to find that authenticity. And I think as
Yeah.
I've found it, she's kind of grown too. And
Mhm.
because my mom, she used to like dye her hair black, and now she's loving, she's a
Embracing
full
the
head of
gray.
gray. She is
Yes.
just like I, because she's 60. I'm not going to tell her exact age, but she's in her mid 60s,
Mhm.
because people see her and they're thinking like, oh, she's like 40 or 50. I'm like, no, she's my mom and
Mhm.
I'm 40. Like,
Right.
she
She is not my sister. This is
she did
mom.
not have me when she was 3. She might she it, that's not true. She was in her mid 20s. Like, no.
Uh-huh.
And
Uh-huh.
so and then she raised me as a single parent. And
Mhm,
so
mhm.
and I have a co-parent. And so
Yeah.
and I'm
Mhm.
thankful that she's spoken into, like, she didn't feel jealous of, or like, because
Mm,
sometimes
mhm.
people, I work with people that don't come from healthy systems,
Right, right.
and she has boundaries.
Yeah.
She lets me have a voice. And I say let
Mhm.
me, but like there are people that can't have a voice within their
Yeah,
family. And so I
yeah.
really like broadcasting that
Mhm.
relationship.
For sure, for sure. That is really encouraging because you're right. Not everyone has that healthy mother-daughter or even parent-child dynamic. And so seeing that, I hope gives others hope for sure. It'll be interesting if I was to bring my mom on the podcast. Because I feel like being a child of two immigrant parents, the notion or the ideas around mental health and mental wellness and even just sharing your story, there's a huge no or stigma around that. I think that it's broadening, and I'm really
Yeah.
thankful that my mom and seeing me, maybe even I'm modeling some of that authenticity and that vulnerability. But I know, like, growing up, I would not have been able to ask her the questions about, like, what was your relationship like with your mom?
Yeah.
Did she ever tell you that she loved you? Or what are some experiences you had when you were growing up in Jamaica that you feel like affected you today? Are you able to say, oh, well, yes, I was feeling anxious then, or yes, I felt depressed when I went through a divorce? Like, she may not have said that to me if she didn't see me myself embracing and being vulnerable and saying, I'm not okay, or this experience really did affect me. So, maybe I'll bring my mom on the podcast.
And she might agree to record it and let you edit it, and maybe she can hear
Yeah.
it and
Yeah.
then
Oh, yeah.
decide. I don't know if she'd agree to, like, live.
Probably not. She's definitely going to say, I need to hear it first. Because, of course, I respect it. She has her own I won't say perception that she has to protect, but I
Yeah.
definitely agree. Boundaries are real
Yeah.
and important, especially in
Mhm.
her life and the connections that she has. But you're right. We can maybe record it and I'll share the first 20 minutes.
And I wonder if she'd be willing to talk about how coming here and what she hoped for you, and what she
Mhm.
didn't have. Does that, like,
Yeah.
sometimes people, that's easier to kind of talk about, looking
Mhm.
at the next generation, because I
Mhm.
know, and then that sharing difficult things, it doesn't
Yeah.
mean that I'm ungrateful or that I didn't
Right.
enjoy it or that there was anything
Right.
wrong with it. But I do. So I work sometimes with immigrant families, and
Mhm.
there can be these. But if they're in my office, they're at least open
Mhm.
to
Mhm.
some type of therapy.
Yeah.
But it can be difficult, and I take
Mhm.
those boundaries very, very
Very
carefully.
seriously. Yeah.
Where I'll never forget doing a feedback session and the
Mhm.
family calling, like, the family in the other country. like like
Oh.
people, yeah, there were family members that wanted to participate in
Oh, wonderful.
their home country and be able to hear the results and the recommendations and
Wow.
everything. And so it was just, I think therapists have to be culturally aware,
Oh,
because
for sure.
if I had told that family, like, oh no, like, this isn't a mom dad client, like, only those
Mhm.
people can be involved, they would have, like, that would have been a very bad experience for them.
Yeah.
But they were okay. Like, I didn't ask this person to participate. They wanted them to be an active participant in the
Yeah.
session, and we went for that.
Yeah. And that makes the change so much. It's almost kind of like you're changing the trajectory of your family's legacy,
Yeah.
because family is so important, especially in like the communities of color. That is maybe a really huge value. And so even as you're making changes and you're embracing, your awareness and destigmatizing mental health, it is also almost kind of like the butterfly or ripple effect. It's now affecting the other generations or the other members of your extended family, and you could imagine what that will do for the next generations to come. I love that, and I agree, therapists definitely have to be culturally aware of that, and and not let their own biases or their own ideas and interpretations of what this treatment should look like or what family should look like, let that get in the way. And I think that's another reason I enjoy being in private practice, because I am allowed to do that, because in some spaces the red tape is it could be very stifling, and it
Yes.
can keep you from like I had a one of my best friends, Stephanie. I was having a conversation with her. Stephanie also worked with us, and I was talking to her about a client who I thought would really enjoy going to a spiritual service.
Yeah.
And it was something that I knew, like the church or the pastors.
Yeah.
And she said, well, this is something that you, if you feel like it would be helpful for them, then maybe you should tell them about it. Because just because there are red tape or people or things that say, hey, you have to keep this separate, because they are someone who relates or identifies also as a Black woman and is sharing with you that their faith is important, it's okay to say, hey, maybe you should take this step, or maybe you should experience this, because it aligns with what you want, your preferences and the treatment. And that authenticity too, and that freedom of being able to say, I see you, I honor your culture and your traditions and your values. I personally feel like that makes even deeper change and impact.
Yes. All right. And so we're going to go on ahead and start wrapping it up with some
Okay.
final thoughts. And so I'll let you think about yours. And
Okay.
so, just based on our conversation today, my final thoughts for anyone listening, especially anyone that might be thinking about, I think maybe I should talk to somebody, or maybe there's this thing that I haven't brought up with my therapist that I really should bring that thing up. To me, I view therapy as, these are the skills that I have, and this is my
Mm-hmm.
problem. And there's a gap
Mm-hmm.
between the
Mm.
skills I have and the skills that I need for my problem. And a therapist can come in and with support, because the client does the work. I
Right.
tell my clients all the time, I can be the best therapist in the world. And if you stay this, like if you don't do something different, like things are gonna be
Nothing will
exactly the
change.
same.
Yep.
Nothing's gonna change. Like, you do the work. So I'm
Yeah.
just here as a support. I am here as a cheerleader, a coach. I'm here to guide you along the way. As a
Mm-hmm.
therapist, I don't give people answers, because
Mm-hmm.
often people are like, I don't want a therapist to tell me what to do. I have never, so unless it's safety. So
Right.
safety is the only time where it's like, ugh, we
It's
gotta
trouble.
we
Mm-hmm.
gotta talk about this. And then, because I just ask questions, it's like, do you think that came from a healthy place or unhealthy place?
Mm-hmm.
And if
Mm-hmm.
it comes from a healthy place, all right. But if
All
it's coming
right.
from an unhealthy place, maybe this is something we need to kind of address and work on.
Yeah.
But
Yeah.
what are your final thoughts for people today?
Well, one, I hope that people see, like we said in the beginning, that admitting that you're not okay and that you may need to talk to a therapist is a strength. That vulnerability is a strength. And it essentially will change your experience, because, like you said, if you recognize that you're experiencing a problem, your day to day functioning is to the point where it's really affecting your relationship with yourself or with others. It's affecting the way that you show up in the world, or even the way that you see and believe the stories about yourself. Seeing a therapist is a great place to start. And although I am a therapist, I hope that people also know that therapy is not the only way that you can make changes in your life. It works in tandem with other things. So whether you're seeing a doctor, whether you are, have a strong support system, whether your faith and your spirituality is a part of that, it's an entire, almost like an ecosystem that works together to help you make a change. And so your mind is connected to your body, and then your body is in this world. And so integrating all the things that can support changes in your life is so important. So I hope that people hear this and feel encouraged as well.
And where can people find you?
So people can find the podcast one, Here We Are. It's called Here We Are with Teka, Teka, on YouTube and on Facebook. And then on Instagram, it's under the Here We Are Pod, POD, short for podcast. And then my practice and the wellness brand is Soul Empowered Wellness, and that is across all platforms as well.
Nice. And I am at Dr. Patrice Berry, Instagram, YouTube, TikTok. I have a lot of fun, the YouTubes and TikTok, but no, and well, Instagram right now.
Yes.
But I am just so grateful that we were able to meet up today. And I hope everyone enjoys the rest of their day.
Thank you.